warahmatullahi wabarakatuh. Good morning everyone. My name is Tiara Zara Putri. Here I want to explain about nursing care for diabetes patient. Okay. The name of diabetes patient is Mr. Z and he is 45 old and his religion is Islam. The client was brought by the family to the hospital with complaints of weakness, dizziness, high blood sugar, and also a wound of the left leg. The one feel painful, and the patient is also worried about having a serious illness. So I told him to tell all the complaints about his illness. The client said the client's body feel tired and weak and often feel thirsty and hungry. The client said the client often had nausea and vomiting and had not had a bowel movement since entering the hospital. The client said that he often urinated 10 times per day. The client said high blood sugar on admission the hospital because the client rarely checks in the hospital. The client's blood sugar level are 284. The client says there is a wound on the right leg and pain in the wound. The client say he is not comfortable with the wound on the leg. There is push on the injured leg. The client say it is difficult when activity. The patient also said that he was worried about having a severe illness. After that, I did a physical examination assisted by other medical personnel. So the result is you can see here, and the first is hair. His hair, round head shape, black hair, no lumps, clean hair, and no dandruff. His symmetrical left and right, no anemic conjunctiva, no icteric sclera, no use of visual aids or glasses, pupillary reflex is occur like reflex plus per plus, and pupil size 2 millimeter. And his ear symmetrical left and right, no bleeding, no cerumen, clean ears, no fluid in the ear. The client's hearing is still good. And his nose symmetrical left and right, there is a lump in the nose. The patient is not instilled oxygen normally, and his nose is normally test. And his mouth and teeth, the condition of the mouth is clean, the lip mucosa is dry, the client's teeth look clean, there are no abnormalities on the lip such as a cleft lip. And his neck symmetrical left and right, jugular vein not palpable, and there is no swelling of the thyroid gland, and there are no lesions, and there is no swelling of the thyroid gland, and there are no lesions. And the next his lungs is symmetrical left and right, chest wall movement, no palpable tenderness, no swelling, pulmonary fills, sonor sound in all lungs, no additional breath sounds or vesicular. Next is his heart, left and right symmetrical chest, no scar, no enlargement of the heart, no swelling or lump, no tenderness, dim heart sound, no additional sound, regular, and no additional sound such as notes and the gallops. And his abdomen is no tenderness in the abdomen. And the last is his back, no palpable swelling, symmetrical left and right, and no lesion on the back, and also no nothing decubitus on the back. After I had a dialogue with him, I got information about his social history. Since the client was sick, he didn't get along with the people around him. The client is resigned to his illness and try to keep his spirits up. Sometimes feeling of sadness arise because he cannot do anything else. especially gathering with his family because he is receiving treatment at the hospital. The client and his medical history. The client suffer from diabetes for the past 14 years. The patient has never been treated for diabetes. The client only went to the health center for treatment but rarely took medication. And I got the details from the physical examination. Here you can see here, yes. And left of consciousness is Compos Mentis, and his weight 57 kilogram, and his height is 160 centimeter, and general condition is good, and the vital signs you can see here. And for laboratorium investigation and imaging results, you can see here for the picture result laboratorium investigation. From the data I said before, I got a summary. The result is blood sugar. The first is blood sugar instability related to insulin resistance, and the second acute pain related to agent of physical injury, and the third is helplessness relates to feeling insulated. And the nursing plan I will do, the first is blood sugar instability. For the blood sugar instability, will provide oral fluid intake education and advise adherence to the collaborative diet and collaboration insulin administration. And the second plan for helplessness, I will provide opportunities for patient and family to be involved with group support and encourage maintaining therapeutic relations with others, and realize that the condition experience have an important value. And the third plan for acute pain, identification characteristic, duration, frequency, quality, intensity of pain, and identification of pain scales, and give non-pharmacological technique to reduce pain. Okay, maybe my information can be useful for you and to face the patient. Okay, wassalamualaikum warahmatullahi wabarakatuh.